low.
Hell fucking low.
Welcome to Honey Do Me Podcast. I'm Cass.
And I'm Emma, and this is our podcast about relationships and sex and masturbation and touching holes and licking holes and putting your finger in holes, or just looking at holes. Yeah. And that takes a lot of confidence too.
Hole gazing.
Goal gazing. Bringing a new definition to goal gazing and goal setting. Wait.
I said hole gazing.
I know. Halfway through that, I was like, that is not what she said.
That is. But you know what? We're all about goals here. We want you to have the best sex life possible. And generally, that takes some goal setting, some intentionality, and some fucking work, honestly.
Fucking work. But you do have to be having some sort of intimacy to achieve this. And I'm far from it these days.
You can be intimate with yourself.
That's true. I can be intimate with myself. The closest I've gotten to intimacy with another person recently was at the chiropractor. And as he was cracking my back, his little pee-pee grazed my elbow. I felt it and I didn't know what to do. So I just pretended I didn't.
Do you think he knew?
How do you not? I mean, penises must be sensitive to touch and elbows and pointy things. That I'm like... So, you get into pretzel pose.
Oh, obviously. Get ready to be cracked.
He's like leaning over you. And his legs are straddling my elbow point. And I just like felt it. I'm like,
it must happen all the time.
That's what I thought in the moment. I was like, do I apologize? I was like, I can't call attention to this. But yeah, it was like, he does this all day. This must happen all the time.
I mean, because I think about like times when something similar has happened. Like I feel like I was at the doctor.
Pogo? Like from
exactly, a pogo. I was at the doctor the other day and the like med aid was taking my blood pressure and like my hand touched her boob on accident. You know what I mean? Because like they bring your hand over to them. So I feel like it just probably happens all the time. I wouldn't know. I'm not in healthcare, but
yeah. I'm trying to think of, it was probably a healthcare situation too, but very similar where like they put my arm up in their boob. Like I get it, compact.
Yeah.
I don't get that. But if we're talking between arm and side, I totally get that. And especially if you're big bosomed, it's just going to happen a lot.
Where are you supposed to put them? Like,
it's not my fault. It's not my fault.
No, I don't think you should take any blame. I think it's better that you didn't bring it up.
I think so too.
I think that would have made it horrible for everyone.
Oh, hello, mister.
Oh my God.
Hello, Mr. Sir. I also attempted to ask out a car salesman.
You did. And it didn't go so well. But I
think he was just an idiot, though.
I truly think it was that. So tell everyone what you did.
Well, he was really cute, and we test drove a bunch of cars, and I think he added cars to the list because I think he wanted to hang out with me, and that's what I tell myself.
Yeah. You're like test driving F-150s.
Hi there.
Hi.
I'd love to try that truck. Thank you. And so at the end of the appointment, how I've ended every car appointment, I'm like, I have to talk to my dad.
It's your out. It's easy.
Yeah, it's so easy. I'm like, blame Greg. And so the next day he's like, hey, what did your dad say about the car? And I was like, he said you had to take me out to dinner first.
You need to say exactly what he said because I want a little bit more of a personality picture painted. He said, hey, what did Pop say about the new Sportage?
Thank you for rephrasing.
Yeah, I think the phrasing's so fucking important. And then you gave your line. Sorry for interrupting you.
No, it's okay. Thank you for the rephrase. And then he said you had to take me out to dinner first. And I thought that was an excellent line.
Yeah. You
come back with, okay, great. But also, I guess I can see how that might be like buying the customer. Whatever. I don't care. I was offering.
Yeah.
And then he said, great, where are you taking him? I'm like, okay, you're an idiot. So
yeah, so he assumed that you were literally just quoting your father.
Yeah,
saying,
yeah. So big miss on that part, and I will no longer be going back to that Kia store.
No, that store is not for you.
No, nothing left for me there.
So disappointing.
I know. But whatever. So that's what's new with me. How about you?
You know, I'm just living vicariously through you and all of your fun that you're having with your penis touching and your car driving. I really can't top it. So there's
don't
really
try,
no
I
point in me
guess.
trying.
Yeah.
It'd be really awkward.
It would be uncomfortable.
But what I can do is I can introduce this week's episode. So if you've been with us so far this month, you know that we are talking about tips, tricks, and naughty bits. One of my ideas that Emma vetoed immediately was just to call it Genitals Month. But
also, you can't say that without sounding like you're, a sophomore in college in like SoCal, like Genitals Month.
Genitals Month. It's actually Genitals Double Month because we're continuing on into next month because there's just so much fun to be had with your genitals.
Double penetrating these months with genitals.
With genitals. Should we say it one more time? Genitals. So we have talked about hand sex the last couple of weeks. We have more coming up about oral sex and masturbation and all that good stuff. But we're taking a little break to talk about health, specifically vaginal health this week. I know it doesn't sound the most exciting, but when I tell you that this episode is fucking incredible, I mean it from the depth of my genitals. Like, truly. Oh my God, this episode's so much fun. We are talking with April Davis.
House of Vagina.
Yeah.
That's her brand.
Just incredible.
That's not just what I call her. That's her brand name.
And I call her my House of Vagina.
Oh my God. But it's just, we get really candid about experiences we've had. I feel like that have either left us with yeast infections or feeling uncomfortable, and things that just people don't tell you growing up about how to care for your genitals and your nethers. And then just like kind of girl chat about our experiences with that and how funny and silly and also terrible and sad it can be. And then the solutions to it. So it's like the best combination episode that you could ask for.
It's so much fun. I'm so excited about it. So we'll just see you on the other side. You're welcome in advance. And we just love you to pieces.
Yeah. So toodaloo.
Hello, I am April Davis. I was actually previously the Vagina blog. I have very recently gone through a name change. I am now House of Vagina.
I love.
I am obsessed. I knew early on actually that I wanted to change the name, but nothing resonated. Like I just couldn't. But I was like, I barely blogged, and then blogs kind of went out right as I got started and went into more social stuff. And so anyway, House of Vagina we are. HAUS, of course, because German. It's the dream. Anyway, do you want to know how much do you want to know?
I guess what's your 9 to 5? What do you do with your life that brings you joy?
This definitely. So I love the platform we built. I also have a podcast called the House of Vagina podcast, which is amazing. I have 3 kids, 2 giant schnauzers, a flock of chickens, a kitty cat, and a very full life. I freelance as well, doing like social media work for other people. I do a lot of design and photo and video and kind of all that type of stuff. So, and then I coach as well. I do menstrual cycle coaching. So it's kind of a hodgepodge. Like my days are full and random.
Honestly, I usually feel that way too. Just full and a little random. So you're in the right spot. You're in good hands. Welcome.
Yeah.
How did you get into vaginas?
Like most of us do.
Head first.
Head first. I get it.
No, it's weird. It definitely was always a natural curiosity. Like that was there. I was like the nerdy kid checking books out of the library that my mom maybe would not have allowed me to had she known what I was checking out. And I ended up, after I had my second child, I was like, I think birth work is probably where I need to head. Like that's what I want to do. And so I wanted to become a doula and accidentally got a job as an assistant to a nurse midwife. So I have a background in emergency medicine as well as visual tech. Normal things people do in college at the same time. Sometimes we do a little photography, sometimes we do a little medical, whatever. Anyway, So I worked for her for years, started taking on my own clients as a doula. Was doing birth photography as well. So I was also kind of observing birth as it unfolded, not there as an authority, but just as a photographer. So I was able to witness some of the gaps that I would say we have in women's healthcare, to put it like so nicely.
So
right?
nicely.
And and so yeah, so I saw all that, went through all that, loved that work, miss it still. But my life kind of got so demanding that living on call was not as much of an option. So after I had my third baby, I realized I kind of needed to retire. And I was like, what does one do when they have this much information about vaginas? And so it just seemed like the right thing to start a blog about it. Because, you know, when you hang out with birth workers, you're like, let's track our fertility. Let's use a menstrual cup. Let's, you know, like, so I was already doing all those things. And I mean, I could talk about sex all day long. So it all comes together.
It's just incredible how many things we all mesh over in the first 3 minutes. I was also the kid that checked out books that had a lot of naked diagrams that my mom was like, please don't bring that to school. And then I'd just smuggle it in my backpack.
The world needs us.
Yeah.
Okay, someone has to be the girl in the corner with the glasses reading the like smut. It's an anatomy book, you know, like
little pervy, little interested. That's all I gotta say.
Yes, little pervy, little. This is a very good way to put it.
That's amazing. Well, this month we're doing, or these next 2 months, we're doing a segment on naughty bits, tips, tricks, and our health, basically. So you're the perfect person, House of Vagina, to talk about vaginal health. So I guess let's just begin with, what do we need to be watching out for when it comes to our vaginal health?
Oh, so many things. So many things.
I know.
Yeah. I think like when we start these discussions, the first thing that I always want to do, and this definitely comes from like being a doula, is empower people that if something feels off, you're probably right. Like, trust your own instincts and trust your own body. I think especially when we live in female bodies, we're not often taught, we're not socialized to trust our body and to trust our instincts. And so if you feel like something's off with your vaginal health, trust that, do something about it. And if you get brushed off and you don't feel like, you know, your needs were met by your healthcare providers, wherever and whoever that is, pursue it, right? Until you feel like you've solved whatever it is that's going on. I think so often there's always fear around like, oh no, something might be wrong. So like we have to like jump that hurdle. But then the second hurdle is, so often as female bodies, we are a lot of times told like, oh, that's all in your head, or it's not bad enough to really need treatment. Or, I mean, I've even, there's this really cool test that just came out that looks at your vaginal microbiome. It's called EVVY, EVVY. So often like people will go in and be like, oh, that's probably BV, and they'll treat it and then it just keeps coming back. Taking that test actually can help you get to like, oh no, it is this specific strain of this specific problem, which needs this specific antibiotic or treatment, instead of like this broad spectrum stuff. So even that type of stuff. One of the reasons that I started the platform that I did, I really wanted to teach people how to advocate for themselves, because when people were getting into the birth setting, that isn't the time to find your voice. I mean, I think for a lot of us, that might be when we find it, right? But for me, I was like, what if I got them at the birth control discussion? What if I taught people to have the birth control discussion with their healthcare providers? And what if people started feeling empowered and able to talk more knowledgeably with their doctors, right, about birth control? Because then if they can develop a good relationship with their care providers with the birth control discussion or the PCOS discussion or the endometriosis, or you know what I mean, like with some of that stuff, maybe by the time that they are getting pregnant and having children, they'll be accustomed to advocating for themselves. They'll be accustomed to, you know, redoing their own research and having more productive discussions with their healthcare providers. Because so much of why I'm doing what I'm doing is our maternal mortality rate here in the United States is on the rise. We're killing more people. So when I was born in 1985, it was safer to have a baby then than it is now in the United States of America. It is way more dangerous.
Excuse me?
And that's, it's embarrassing. That's embarrassing. Like, that is not the direction that we should be going. We pay more for our healthcare than any other developed nation. And we love to, USA is number one. Oh, no, it is safer to have a baby in Latvia. Cuba is doing better than we are. Like,
oh my God.
Yeah. So with that knowledge, I was like, what do I do? Like, I know this. What do I do? If I can educate people, if I can have them at least learn their anatomy, learn what the risks are to like the birth control and stuff. And it's hard because I'm like, it's not that I'm anti-birth control, but you need to know what you're putting in your body and what it's doing to your body and how you can combat this and work with it. Right. And then also know what the risks of all the other things that we kind of get put through. And then also know that so often, like, when women go into their healthcare provider, average, I think, route to like getting diagnosed with something, it's like 6 or 7 years. Like, that's crazy.
Insane.
You know what I mean? Like, that, it shouldn't take that long to get diagnosed with something. And that's where it is. But when you also find out that like female bodies didn't have to be included in studies until 1993, and the clitoris didn't have to be included in the female anatomy until 2019.
What?
That's very recent.
What?
Yeah. Yeah, we didn't find it till 2005. That's the year I got married.
Wait, what?
Yeah. They didn't know the full anatomy of the clitoris and have it documented. 2005. A woman was like, what if we did an MRI?
What if we looked?
Wait, holy
Imagine.
shit.
It is hysterical. I have a presentation that I do on the history of the clitoris, and it is comical because up and down through the ages and all the medical, right? They would be like, we're seeing this thing, but we don't like know what it is. It's probably part of the woman's shameful anatomy. We'll just add it to the heap of
Probably
shame.
look away.
Mm-hmm.
Probably just completely look away.
Yeah, exactly. Yeah, just
ew.
It doesn't seem to have a function. So we don't care about it, and we're not going to include it. Because, like, picture in your mind every pelvic diagram you've ever looked at of the female sexual reproductive anatomy. Was the clitoris included?
Just those ovaries.
Just those darn ovaries.
Holy shit.
But, like, why in the world, if you're looking at the female reproductive organs, why would the clitoris not be there? That doesn't make any sense. And if it is, on the off chance that it is, it's typically this. They're like the nub. They like show the tip, right?
The rosebud.
Like, no, there's
Yep.
the rosebud. I know, the embroidered. The doily.
We're pretty sure this is just embroidered on.
Truly. I literally
add-on.
came out with my own vulva plush so it would have the entire clitoral anatomy because I was like, I am done with the doilies.
Yeah.
I can't do this anymore.
Holy shit.
You are just...
Guys, it's bad.
Yeah.
It's real bad out there.
Real bad out there.
You're blowing our minds. I want to comment on so many things that you said. I have endometriosis. Took me 10 years to get a diagnosis. So right in there with that statistic. And I think what you were saying about how people aren't taught to advocate for themselves, and then they don't start advocating for themselves until they're in that birthplace. I think that's so interesting because even then, they're not really advocating for themselves. They're advocating for their baby. And like, that's the reason that they feel safe enough to advocate.
That mama bear has to come out for us to care. How sad is that? You need the mama bear for your own
Like
body
that-
as much as you will for the child you're making.
That fucking sucks.
Yeah.
Like, you deserve it too.
Yes.
Ugh, that's very frustrating.
That is very frustrating.
And what's even more frustrating is oftentimes when that mama bear instinct kicks in, they're not advocating for themselves still. They're just like, just save the baby. That means slicing me to shreds. And of course the doctor's like, thank you for permission. Perfect.
Perfect. I will slice you to shreds.
Let me rip you bow to stern. Excuse me.
And I mean, really, there are truly so many good doctors and good nurses and good healthcare providers out there. They do exist. Unfortunately, there are also some terrible ones that are really not helping. And killing women and people at record highs in childbirth.
That is a staggering statistic that we are at. It's increasing the risk
Worse.
to have.
It's increasing. It goes up every year. It sure doesn't help that Roe v. Wade got overturned.
Sure doesn't.
Forcing people to stay pregnant is not helping our maternal mortality rates.
Really? That's not helping?
It's weird.
That's
It's
so
weird. Like when you say it out loud, it seems like it wouldn't be true, but it is.
Huh.
Oh
So
my
interesting.
God.
It's almost like we knew. It's almost like we knew exactly what would fucking happen.
Weird.
Yeah.
Super weird.
Super interesting.
Holy shit.
Well.
I'm really interested in that EVI test you said as well, I believe.
Yes.
EVVY. In college, I had like a really bad bout with yeast infections, and I'm sure a slew of other things, because it kept coming back. And one, I was never told that you could pass it back and forth if you're having sex with someone. Never knew that was
You just saved someone else. They heard you just say that and they went,
oh. Yeah. I had no idea because it never showed up on him. And I'm like, oh, he has a penis. He can't get a yeast infection. And so
they definitely can. Those dirty penises.
Those dirty fucking dogs.
dirty dogs. And then, but I would just keep getting like that flu pill. What is that called? Though it starts with an F. Over and over again. And it's like, okay, first of all, I have no idea what this is actually doing. Second of all, it keeps coming back, so this can't be the only thing that's going on in my system, but that's the only thing the like school health center would give you, because like, oh, it's kind of like this, like, yep, just take this, and if it doesn't work, take it again and again, and then you should be good. And it's just, it's so shitty. It's so shitty that that's how we treat it. That's how we treat the vagina.
I know. I know. She's an afterthought. It's unacceptable.
It's unacceptable.
It should be priority. Number one. Like the clitoris should be the beginnings of when you're drawing the female anatomy, right? That should be the start.
If you're considering how big it is, yeah, because that's you're drawing over it after. It's like, okay, to begin, we're this big.
Yeah.
And then we come over. It's insane.
Yes. Well, and it's hard to. This is the other thing, and this is me. This is just, but Western medicine is maybe not always the best route. I know it's weird saying that a medicine with a very checkered past in racism and misogyny is maybe not the best place for women's healthcare. Just, you know.
But bear with me. Bear with me.
But bear with me. It's tricky. It's really tricky because I get doctors that get real mad at me on the internet and nurses that get really mad at me because they're like, that, and I'm like, look, where you guys are coming from, the history's checkered. I don't know if you know this. So sometimes alternative medicine routes are the best way to go. Like if you have a repetitive yeast infection like that, I'd be like, ooh, let's talk about candida. Let's talk about maybe changing up your diet for a minute. Let's kill the yeast by not feeding it. Because if you stop eating sugar, which is not fun.
I don't like that solution.
Yeast has nothing. No, I can't recommend this. But
I don't recommend
yeast
doing
has nothing to eat. It's not a fun month.
Right.
But, you know, and it frustrates me because like your Western medicine doctor is not going to sit down and tell you that that's what you should do.
No.
And that's definitely, I mean, I had a very stubborn yeast infection for a while. Same thing. It would not clear. It was super frustrating. And that's what I finally resorted to. Cleared that out. Like, no big deal. And I was like, why did I have to go read all this on the internet?
Yeah.
Like, I joke all the time. I'm like, I, as an Instagram influencer, should not be your best resource.
Right.
But what frustrates me more is that over and over again, people will be like, my doctor said they don't have time to explain this to me and it's not their job to educate me. Those same doctors would then get mad at me for providing education because I am not a doctor. And I'm like, oh, so we're just
live in the dark,
supposed to know everything.
Close your eyes and take what I give you.
Exactly. And if it doesn't work, just take it again.
Take it again.
Again and again.
And absolutely don't look at your clitoris.
No, no. We don't know where it is anyway, so it might be fake.
It might be fake. I've heard rumors. I don't believe them. So,
but I mean, like think about this too, right? This is where it gets extra terrifying. Labiaplasty is up 500%.
500.
And those doctors performing those labiaplasties, was the clitoris included in their anatomy education?
Oh my gosh.
Those are the guys cutting off your flaps and parts.
Your flaps.
Don't get a labiaplasty.
I actually never really thought about the process. I just knew that they were talked about. But
yeah. They go hacking in there and they chop stuff off. And sometimes they mess up and it's real bad.
Oh God.
Yeah.
Haven't seen that episode of Botched.
Yeah, no one thinks about like your clitoris, right? We all know how big and delicious and wonderful that is. She extends out into the labia, out down, down and surrounding the vaginal. And so if you're in there hacking away at things,
Fuck.
like I said, Western medicine,
Yeah.
maybe just
Oh my gosh. Well, that just
I
gave me
know.
so much more appreciation for all the flaps.
Same. I
Yeah.
love my flaps. I want to keep all of
I'm
them.
going to keep them all. All 17.
Dude.
I'll keep them.
What would my husband chew on for crying out loud? I'm telling you, you have to make this stuff funny or else it's just crying.
God.
It's just endless tears. And so you're like, let's make it funny because then I won't cry when I talk about this.
Oh my God. That was so funny. That's hilarious.
That's perfect.
Fuck.
In the name,
You put that one on the internet.
Yeah. That was made for the internet. In the name of making our vaginas a priority, making it more central to our daily lives, are there any how would I hit this? Are there any regular self-checks that we should be doing when it comes to our vaginas and vulvas?
I think prioritizing it is actually the best thing that you can do. Like, as you were saying that, because here's one of the bigger issues. Many of us are socialized to have a lot of shame around our sex lives, around our anatomy, even around menstruation, right? All of these are cloaked in shame and secrecy. And because of that, we don't always go advocate for ourselves the way that we need to. We also don't advocate for our own pleasure the way that we should, and we don't prioritize these things the way that we should. I ask people all the time, I'm like, how many books have you read about dieting? How many podcasts have you listened to? How many shows have you watched about which diet you should be on, an exercise program? And how many YouTube rabbit holes have you been down about keto and veganism and eating raw dairy? You know what I mean? Like, how many of that stuff have you done all of this research and rabbit hole searching down? Can you do double that on your clitoris? Can we do double that research on female pleasure? Can we do double that research on how to best take care of ourselves? Like, because that's a way funner life than just trying to lose weight all the time. So much more fun having orgasms. Highly recommend.
Yeah.
And I mean, really, it burns calories. So isn't it the same thing?
Yeah. Do even the laziest of orgasms burn calories?
Yes, absolutely they do.
All right. Good to know. So I did go to the gym.
All those yummy hormones. Yeah, exactly. But so I think get rid of the shame, and whatever that might look like, going to therapy. That might look like just, reading a couple empowering books about this and getting to know yourself better. That might look like going to a class or, whatever, but get over that shame piece of it so that when something does come up, you're like, oh, just like if I broke my leg and I would go to the doctor, I have a weird discharge coming out of me and I should go to the doctor. And when I get there and the doctor goes, I don't think your leg's really broken. You would say, yeah, it definitely is. You would not go, oh, it was shameful of me to bring this up anyway. Okay, I'll leave. Right?
Yeah.
Right. We gotta advocate for ourselves like our legs broken instead of like, oh, there's a secret thing.
Yeah. Advocate for yourself like your
important.
leg's broken. I love that.
Yeah. Yeah.
So true.
As far as checks go, I'm a huge advocate for paying attention to your menstrual cycle. If you are on hormonal birth control, your cycle is most likely kind of shut down. So it's going to be a little bit different because birth control prevents ovulation from happening, right? Unless you are doing like one of the IUDs. All the rest of them kind of shut things down. But a normal cycle should look like bleeding while you're menstruating. You should be kind of crumbly discharge, dry discharge. You should, around ovulation, see that discharge turn into like slippery and then into like egg white. And then it should go back to kind of slippery again. And then you go back to crumbly and then you bleed again. So you should be kind of seeing that happen. If you are seeing watery discharge all the time, you probably need to go in. If you are having a ton of discharge, like other discharge all the time, you might want to pay attention to it. if you have a cold, your vagina often gets a cold as well. So like you're going to produce more mucus. So like that's pretty normal. If you're sweating all the time, you're probably going to be a little bit more mucusy. So like that's not a big deal, right? But if you are just a running faucet down there all the time, and especially if there's a smell or chunkiness or weird colors that don't make any sense, you're going to want to go in and see somebody. And you're going to want to do that sooner rather than later. We don't want these things to get out of control. If you have any lumps, bumps, itchiness, ouchiness anywhere, you're going to want to investigate what that is. That's getting a mirror, that's squatting over the mirror, and that's taking a look at things. I recently just talked about Bartholin's cysts on my Instagram, and I was really surprised that so many people had never heard of those before. We have glands that go kind of down the inner labia that can get clogged, and when they do, they can form cysts, which look like kind of big, mean zits, and they hurt so bad. I had a couple people DM me, and they were like, oh, I just thought I was like breaking out or something. I didn't realize that this was like considered a cyst. They can get serious. They can get big. They can be very painful. And that's a reason to go seek medical attention. If you have multiple partners, you are going to want to really stay on top of your vaginal health and make sure that you're paying attention to a lot of those things that are going on with your body. Make sure that you're getting screened regularly. I highly recommend always using protection if you have multiple partners, and consider doing things like finding the brand of condom that works for you instead of relying on your partner to provide condoms. Find the brand of lube that works for you, because the cost to you is greater if a condom is irritating or if a lubricant is irritating. So don't plan on your partners having those things. You pack those things. You have those things with you. You use the stuff that's good for your body. Our bodies don't love multiple partners because it's just reintroduction of new bacteria all the time. And obviously this is not to shame anyone. Vaginas are just particular. They really like same. So if you're introducing different, it's going to set you up for potentially experiencing BV more often and some of these other, when you're, microbiome being upset. And your partners should always have clean hands, clean mouths, clean penises when they're coming anywhere in contact with your vulva and vagina. So prioritize that as well. Like if they haven't washed their hands and you're going to do stuff, pause, wash up. And once again, that's especially important if you do have multiple partners.
Right. I can't imagine how hard all of this would be if looking and investigating and feeling comfortable just like staring at your own vagina and vulva is a hurdle. And so for you to begin there makes so much sense, because it is embarrassing. Even alone in the bathroom with a hand mirror, I'm like, oh my God, I hope no one's watching. It's like, who the fuck's watching? The door's closed. But like, and I live alone. No one can walk in, but I still close the door. So that's actually kind of funny that I do that. Yeah. So if the hurdle starts there, like all of this is such unknown territory, and you don't know when something looks off or feels off because it's so awkward to look down there. So beginning there is such a good point.
And it's so, go ahead.
You need a baseline.
Right.
It's so easy to gaslight yourself too when you do see something that's kind of off and you're like, well, maybe it's not that big of a deal. Like, I don't want to make a huge deal and make a doctor's appointment and go all the way in and then have them tell me, oh, that's just your vagina. Like, you just haven't seen it before. Yeah. Like, I don't know. That just feels so awful. Yep. And that's why I guess like really good healthcare providers are so important.
They are.
I mean, it's also a little, it's hard to open your legs to a stranger too. So again, if you're not comfortable yourself, I mean, I've been to our doctor, well, the one that Cass and I used to share, but so much that now it's just like, hello, good morning, go look around. You know it as well as I do.
Get in there.
But again, that's because I feel like over these last few years, I've really tried to immerse myself in knowing more about my own vaginal health and what it looks like. But yeah, if you're already uncomfortable yourself going to a doctor, I'm sure there's more shame wrapped up in that too.
Oh, absolutely. Yeah. Well, and I, if I can offer any assurance as someone who's now seen so many vaginas, they don't remember. Like they don't, I don't, like I've seen so many of my friends deliver babies. I like don't, unless there is something absolutely bananas about it, right? That is so original and special, which is very rare. I don't remember. They are all a blur of fur and flaps, and you know what I mean? Like they don't care. They're not thinking about it. It's as interesting as looking at like your arm. And so just like you're like, yeah, I don't know that I could pick my friend's arm out of a lineup. Yeah. I also couldn't pick out their vulvas. Right. You know? So yeah, your providers, they don't care. They've seen a bajillion of them, and it's not something that they're thinking about at the end of the day, other than like, you know, how can I treat my patients better? Right. That's what I would like to think.
Honestly,
about at the end of the day.
As silly as like that may sound to say, that it's always reassuring to hear of like your doctor does not remember. Because I do think about that when I open, I'm like, oh, here she goes. Like I think about that. So it's nice to hear that no one remembers.
If you have a tattoo above it that says "Eat Me," like, yeah, that's gonna be like, oh, she's got the "Eat Me." Oh yeah, I remember.
I remember that one.
Then that's a good memory. So
yeah,
and it's a good memory. So still, not even if you're memorable, right? It's not necessarily a bad thing.
Yeah.
Are there things that we do that negatively impact our vaginal health? Like I'm thinking, like wearing certain types of underwear. Like are thongs bad, or I don't know, staying in wet clothes? Like what are things like typical things that people do that really fuck with the vaginal health?
Okay. So yeah, don't stay in wet clothes. Okay. I do this every summer though. And every summer I'm like, oh yeah, not so yeah, don't stay in wet clothes. Breathable. We want things to breathe. And if you are going to be in shapewear for the day and spandex and a thong, right? Let's say you buy those Free People, you know, jean panties that have been going around lately. They're making the rounds on the internet. Reward your vagina by sleeping without underwear that night, right?
She gets a night off.
Let her breathe. Yeah, give her a night off from the panties. So, and also as soon as you start to get that, like, ooh, I'm getting a little bit raw, I'm getting a little bit itchy, take the undies off at night for sure. Let it all breathe as much as possible. Switch to cotton only and super thin cotton. Like at the first sign of any of that stuff, cotton for me. And then there's a salve that I cannot recommend enough. It's by Mama Taro Apoteca.
Gorgeous.
Okay.
It is. Yes. And I know the owner, she's absolutely incredible. Like I love them, but their salve is amazing. They have an oil, they have a salve. As soon as anything gets a little bit, I just start using that. It's actually been super handy because I use it on myself, but also my son's not circumcised. I've been able to use it on him when he started to get a little bit of the itchies. I've used it on both my daughters. So it's one of those things that's real handy to just have around because it nips it in the bud before you end up with full blown BV or a full blown infection. So I love that stuff. I swear by it. I'm also not a huge fan of tampons.
Okay. I was going to ask about this.
So yes, it is so interesting. I go back and forth on it. Some studies will say that they are completely and totally safe. I was reading one today that was really funny because it was we used 4 different kinds of tampons. We selected young women that were on birth control, who had not shaved, had not used any sort of body wash, who had not had intercourse in the last 72 hours, who had the parameters around it were this. And we noticed that they had absolutely no problems whatsoever with tampons.
So if you just sit there,
not one.
You'll be fine. Stop complaining.
Fine. Yeah.
Well, I was like, this is obviously paid for by Tampax, so I don't trust it. And it was just so comical. I was like, but they have seen that tampons do break down in the body. So they're going to leave some fragments. They are dry, scratchy things. At the end of the day, I love it because they'll be like, they cause toxic shock syndrome. We're not totally sure why. It's weird that the bacteria would have an easier way of getting into your body after scratching up your vaginal mucous membranes. I don't understand. We don't know why, but it does. You do have a slightly higher risk of toxic toxic shock
You're
syndrome.
just shredding
Like,
your
which
vagina
is
on the
so-
way in.
Yeah, like as anyone who's pulled out a dry tampon can be like, I know why. I can tell you why. I know exactly why.
Yeah.
Right?
It's
Yeah.
an awful
So
feeling.
just, it's the worst. It's been interesting. Probably my favorite. As I've turned people towards things like period underwear, I get the funniest DMs of people like, why in the world was I using tampons ever? Why did I ever do that to myself? Most people experience their period being a day or two shorter.
Really?
But you have to think, well, if you're allowing yourself to just bleed out instead of plugging a hole,
Yeah.
That might logically make
point.
sense.
it's just science.
Fair point.
Women in STEM.
And you have to think too, if you're like trapping all those clots, you have the tampon degrading and possibly leaving stuff behind. We don't always know what the tampons are made of because they kind of they like change the what they're made of based on what crops and when and how. Even organic ones, organic doesn't mean that they did not use pesticide. It means that they used organic pesticide.
Oh.
Yeah.
That extra dollar was for nothing.
So people are like, oh, and honestly, an organic tampon might work better for you than a non-organic one. So I'm just not a fan. I just feel like there are better ways. And I do have some people like, I tried all this stuff. I don't like it. I'm just going to do tampons. Don't hate me. And I'm like, I'm not going to hate you. I have no judgment whatsoever. Like, it's what we've been using. And to be honest, once you hit adulthood, you're like, I don't want to try any new things anymore. I just want my comfortable things that I've been doing for 10 years now. This is already hard enough as it is. Why are you making me put a cup inside me? I don't want to do that. And I get it. You really have to go into new period products with the gumption of a 13-year-old that wants to go to the swim party. And if you don't have that,
So true. The gumption.
You're not going to go through the learning curve that it takes to figure out how to use a menstrual cup or a disc, right? You have to go in with like, if I don't figure this out, I don't get to swim, and my boyfriend's going to be there, and I want to swim, and I don't want to be the lame kid sitting out because, you know.
And everybody's
like,
going to ask me why I'm not swimming.
Why I'm not swimming, and I have to look at it and be like, I don't feel like it.
I don't like water.
I don't like the water. Which is a total lie.
We love the water. We love to swim. You have no
love the
idea how
water.
bad I want to play mermaids. No idea.
Yeah, see? You got to go in with mermaids aspirations, right? And so but not everyone's willing to do that. And I get it. Period panties are definitely the quickest, easiest, like, switch to something else. It is so funny because I think we all also have terrible memories of living in pads initially when we first started bleeding. And so when I say period underwear, people are like, oh, no. And I'm like, no, you sit on a gentle cotton cloud that you just bleed on, and it's wonderful. Like, they're the best. Even the ones that I've tried that are thicker, I'm not mad at it.
Okay.
Like, unless you need to be in spandex, being in like a thick, soft panty is like catches your menstrual flow. It's so nice.
I mean, if you use that tone of voice, you can talk me into anything.
Right? Yeah. Like and reusable pads, I was like, no, I don't think I'm going to be into those. Same thing. They're like thick, soft. They'll put them on like Minky sometimes. And you're like, my vagina has never been more happy. My vulva is so cradled right now. She feels so plush.
Splash.
It's the best. It's
So
the best.
with period panties, are you changing those? Like, how often do you like change them?
Depends on how heavy you're bleeding,
Fair
right?
enough.
So, and they, just like everything else, have kind of absorbency. So they have like heavy, medium. There's period underwear thongs. You know what I mean? Like there's a variety now. We can go places. But so yeah, like first day bleed for me, especially if I'm going to be at my feet where I'm like maybe bleeding heavier, I'm probably going to need to switch undies every 4 to 6 hours, maybe 8. But that's not it's like as easy as switching underwear, right? You're just like, oh, I just changed my undies. So even if I was like, I work from home, so I'm home most of the time. But even if I was out at a job, it would not be that big of a deal to go change my undies. Or you could even do like, oh, I'll just wear a cup today. And that's, if you are a tampon user, period underwear is the best backup ever, like to have for if you have leak throughs, and you know. So, and it's been hilarious. So my daughter, is 14, and she's been getting all of her friends on them because it was when she started bleeding, it was so nice. She was being like, oh, on those days there were these undies.
Oh my God.
I love that.
And that's all. There was no like, okay, we have to, and then you have to stick it. No, you don't stick it to yourself. You stick it to the underwear. Yeah, okay, you got it. And then, you know what I mean? Like there's no learning curve. It's just like, see these, you wear these.
Yeah.
And then we rinse them out and we throw them in the wash afterwards. Like, they're amazing.
I've never tried them. Cass, have you?
Yeah, I do. I generally use them with a cup because with my endometriosis, I feel like I have really heavy periods. One concern I have with them is I feel like I notice a smell. Like, and that kind of bugs me.
The thing, Thinks have a silver lining.
Okay.
On the inside of them that's antimicrobial, so that actually does help with smell. Something else to keep in mind too, typically it's when it hits air. And so like if you've been bleeding and you like pull your undies down and sit down, to go to the bathroom, as soon as all that hits air, that's when it's like,
okay,
you know what I mean? Like that's when you're gonna get like, oh, do I smell? Am I smelly?
Right.
It's not usually when it's close to the body. And honestly, like my friends don't typically bury their noses right into my behind as soon as I see them. If they did, I would be way more worried.
Bury their noses.
But I had similar concerns because I was like, I am going to wear these until I feel like I can't. Like the first time I ever used them, I was like, I'm going to wear them as long as I possibly can. And I'm going to like ask people like, can you smell me? Like, is this? And to this day, have not had anyone external from myself be like, excuse me, ma'am.
I can smell your
smell
blood.
like a rusty dumpster.
Yeah.
Well, I feel like with kids, a kid would tell you if you stunk.
Totally.
100% they would, especially my children.
I trust you. I trust
the
youth
youth
they
of
haven't
today.
told you. Yeah.
Mm-hmm.
Yeah.
Then okay.
I have a question that's similar. Cass mentioned it. And it kind of goes hand in hand with wiping. So if we can attack both of these. Thongs, I saw a TikTok that someone, and I don't know if she's a doctor or not, but was explaining that they're really like not hygienic for you to be wearing since the material can slide back and forth all day, which has left me paranoid, but I still wear thongs because I hate an underwear line. And then also wiping when you go to the restroom. I'd like to attack both of those when it comes to being hygienic for your vagina.
I have to ask first, why do you hate an underwear line?
That's a great question. I don't know.
Right?
It feels embarrassing. I've thought it.
Why?
I guess I just haven't changed my mind about it since middle school, and I've never thought about it again since.
Right?
Yeah.
It's so funny. Do you guys follow the Birds Papaya?
I was just about to bring up, please.
And she was like, why have I been worrying about underwear lines? Everyone wears underwear. In fact, it would be weirder for me not to be wearing underwear, right? So why do we care about panty lines? And I was like, oh my gosh, have I reassessed this?
That's
why
so
do I
fucking
care that
true,
people
though.
know I'm wearing underwear? It's literally that scene from 13 going on 30 where it's like, can you tell I'm wearing underwear?
Why?
Because she wants people to know she's wearing underwear.
Yes.
That's a really good point.
So truly though, there are some outfits where you're like, it's distracting. I like want it to be in a different place. I'm going to go put a thong on. You know what I mean? So I'm like, I feel you on some of it. But generally speaking, I'm like, why are we worried about this?
I think it started when I was in middle school and the underwear that was popular was from Limited 2. And the whole, every, like the outline of it was like padded. It wasn't flush to your skin at all. So when you'd put on pants, it'd be like, underwear line is right here. If you can't see it, it's right here. Yeah. And then I just have been mortified ever since, I guess. But that's such a great question that I should ask myself at 28. If I'm still embarrassed and why that's a thing. Great question.
I had a boyfriend's mom in high school point it out on somebody else, like as we were driving. She said, VPL, like an alert through the car, visible panty line. And I was like, what? What are you talking about?
What did beauty magazines do?
So I
us?
hear her in my
happen?
head to this day. Shout out to you. You know who you are.
Shout out. That is so.
There are no words. That's crazy.
Yeah, that is super crazy.
I was watching Lessons in Chemistry and thinking about how bizarre it was that the narrative that women had with each other was oftentimes women's magazines and even like newspaper ads and things like that, which were written by appetizers that were men a lot of the time. they controlled the narrative.
That's why the
For
narrative
so many
sucks
years.
so much.
Like, bless the internet. You know what I mean? Like, I'm like, I cannot believe that for so many years. So like that mom, you're like, oh, you were unfortunately a product of your time because of the like literal poison you were drinking. Like,
wow.
it's so bananas. So yeah, let's take back panty lines, people.
I love
Let's
it.
let the world know we're wearing underwear.
A rally cry of the ages. Take back underwear lines.
Yes. Along with everything else we need to take back.
It doesn't have to be top of the list, but it can be somewhere.
It should be on the list.
Just put it on there somewhere. Maybe it's in the bottom, but put it on the list.
But it matters.
But as far as thongs go, I would definitely second that. In terms of hygiene and stuff, they're not great. I think if you have a thong that sits where it sits and it's not, all over the place, probably fine, right? You know what I mean? Like, the other thing too is it's all of our own stuff. Like, obviously you want to be careful with that, but at the same time, like, I think sometimes we can get a little obsessive and worry, and it's like it's all of our own germs, right? And if it's not a problem, it's not a problem. But if it is a problem, stop wearing thongs.
Right. That's true.
So it's like tampon use. It's like all these things, right? If it's not a problem, then it's not a problem. So, I would say that about thongs. And if you've been wearing a thong all day, like I said, maybe give her a break and sleep without anything at night. Or I wouldn't sleep in thongs. Like, I would wear them during the day and then maybe switch to undies at night or free ball it, and just let her breathe.
Yeah.
People sleeping in thongs?
The depth of which
not, please. Any of you out there, if you're sleeping in a thong, I need you to commit to me that you're going to stop right now.
if I've gone to bed after like going out and I like just put on sweats when I walked in and let's say whatever, I've done that a couple times, and the depths of which I need to dig out my thong in the middle of the night.
I can't. We shouldn't be living like this.
It's criminal, torture, cruel and
No.
unusual.
No.
And I am
It's
not okay. No, I would never do it on purpose. I would only do it if I was a little drunk coming home by accident.
Yeah. Yeah.
And it's just absolutely awful. So yeah, I second.
No, I remember when I got my first thong, I went to wear it to bed and was like, I don't think grown-ups do this.
There is no way.
I don't think they should.
Can't do it. If you've seen Pen 15, have you seen that show?
Okay, it's like I haven't gotten around to it. I need to.
You should.
So badly.
You absolutely
I know I need to. I know.
The episode at which they like figure out a thong for the first time and the two main characters wear one for the first time. That is how I felt the first time I wore a thong. And I think that lasted for like 5 years.
Such a rite of passage.
Yeah.
Isn't it just that? Well, and it's my daughter like asked for them, and I was like, oh yeah, I will 100% buy that for you. You need to have this experience. Enjoy. Don't sleep in it.
Don't sleep in it if you promise. But when you go to Wet Seal for the first time at 13, and you get a G-string $3 thong.
Oh yeah.
And it doesn't have any elastic. It just digs
none whatsoever.
Everywhere.
Yeah,
and it's neon.
Rue 21, the 99 cents bucket.
Those were just such a
You haven't had that life experience. You need to.
If you weren't there, I can't explain it to you because it was just incredible.
I just Wet Seal I miss, first of all. Second of all, remember when you would want something that was all the way on the fucking ceiling?
Oh my
in
god.
Wet Seal? Yeah. And so you had to have somebody come over with a giant pole to get it down.
Oh yeah.
And then they brought it down and you're like, I don't think I want that. I'm so sorry.
Never mind. Now that I can see it up close, I'm
the
not
quarter-sized sequins are actually not for me right now. But thank you so much for craning it down to me.
But like the post-traumatic stress of going into Tilly's right now for me, because my daughter is in 8th grade and she's wearing clothing identical to what we were wearing in 8th grade. And I am like, I don't understand. I don't understand the loop.
Yeah.
It is freaking me out. Like, I can't.
God. My favorites were my brown plaid shoes. They were Velcro. They didn't have laces. And they were like a little torn at the top. so they'd kind of slip
yeah.
off, but they were brown plaid,
Mhm.
and
Yep.
it was cool.
Yep.
And life
It
was
cool.
good.
I
Life
remember
was
those.
good.
Life was good.
You could slip them on, kick them off.
I know.
Ugh. Anyway.
So wiping.
Yes. Yeah. Looping it back.
Something else I messed up in 8th
Looping
grade.
it back.
Yes, please.
Yes.
Hey, you know what? We all have to learn some things the hard way. It's
Mhm.
okay. All right.
Mhm.
Front to back.
Oh.
And if you have limitations like that, you can always push from front to back, right? So if you're going, like if you're
Oh.
reaching from the front, you can always start in the front and push to the back. No big deal,
I
right?
like that option.
But front to back. We want to try and avoid getting any sort of fecal matter anywhere up in our bits as much as possible. Like I said, you know, they kind of obviously they know each other, these two orifices, but we don't want them to know each other well,
Right.
per se.
Very specific question. You've already gone in for one wipe, full front to back, and you want to just wipe a little more in the front. If you start close to the front and just stay at the front, can you wipe back to front?
Probably. You know what actually needs to happen? Americans, I need you to listen to me right now. We're going to commit to this as well, okay? Buy a bidet and get rid of all the rest of this nonsense. Because once you own a bidet, you will wonder why you were such a disgusting human before owning a bidet. Sorry, I have dogs behind me.
No worries.
They also,
You
bidet.
will wonder. Yeah, they also love it. Like when you are menstruating and you can just sit down and hose yourself on down and not have to, and then just pat dry. And then just pull up those period undies and bleed all over. It's the best. And like I splurged because my husband spends a lot of time in there, obviously, right? And so for Christmas one year, I was like, we are getting the fancy Costco bidet. It has a heated seat. It blows your bum dry. It has warm water. So I can crank that sucker up to the hottest water setting when I am menstruating, and I can also crank the seat up to the highest setting. I sit my cheeks down on a warm, wonderful seat, and I just hose myself down with that warm water, and then I blow it dry. That is the life that we should all expect for ourselves at this point, right?
Absolutely.
Like, I know why toilet paper is so
yesterday.
It is. It is. Just pat it dry.
Yeah.
Also, and I haven't done this for a while on my stories, but there are people in my audience that have theories that some toilet papers irritate them more than others, and that some brands are better than others in terms of irritation, and like have switched away from brands and not had BV anymore.
Whoa.
Which I'm like, okay, you have a very sensitive vagina
Yeah.
and vulva. But when and if you do have anything going on, you need to become the best little detective you've ever been in your whole life. Did you change your laundry detergent? Did you change the brand of your tampons or your pads? Did you change the brand of your toilet paper? Did you change, has anything unfamiliar or different come in contact anywhere near your vulva or vagina? It is hysterical because I will have people DM me and be like, oh my gosh, I'm having this problem and I have no idea what it is. And I will start asking these very routine questions. And immediately the light bulb will come on of like, oh, we switched lubes and I totally forgot about it. Oh, we switched laundry detergent brands. Oh, I switched toilet paper. I switched panties. Like I'm using a different fabric of panties than I used to use. Like anything that happens, that's the first thing you should do is go, what changed? And it can be something as ridiculous as toilet paper.
Wow. That's incredible. I had no idea that toilet paper could do that to some people, but also a very good point about detergent because I always forget that. I'm never someone that really sticks to one. If I'm at the store, I'm just like, spring fresh, sure. Or I just pick a random one. But that totally could be irritating. Interesting.
Oh, absolutely. Same with like, oh, I was visiting my parents' house and using bar soap that I forgot about, like it's, we can be sensitive critters and it's fine. It's part of it.
Well, and also with toilet paper, not that this would ever happen to me, but like sometimes little pieces get left behind and you don't realize it, and then somebody goes down on you, and they find it.
Solve all of these problems. Like you never worry about doing doggy ever again.
That is nice. Also, the warm toilet seat. I feel like I don't take enough time in the bathroom. I usually just get in and get out. But every time I've tried a bidet, there hasn't been a bidet I've met I haven't liked. So
I'm telling you, if you take one thing away from this, get a bidet. They're just the best.
Yeah. You've convinced me. How much is an expensive Costco bidet?
I think it was like 300 or 400.
Okay.
Like it was not, it's an attachment that you put on your seat. And you do have to plug it in separately, but it didn't need like a special hose or anything. Like it just attached to your normal, like you didn't have to install anything wild.
Okay.
We literally just had to like install it, plug it in, hook it up, done. And it is so worth it.
So worth it. God, that would make my morning
I will never go back.
Another, like, is this good for you on my mind? Like going completely bare down there. Like, is it better to have pubes? Is it like healthier, or does it matter?
So our pubes do serve a purpose. Say they wick sweat and all sorts of other things kind of away, right? They also are their own kind of not necessarily lubrication, but like friction preventers, right? When we're riding someone, right, we have this little extra bit of like help in terms of not creating friction. Obviously, too, if you're shaving bare, you're opening yourself up to possible infection and other issues in an area that if you're then also wearing yoga pants all day that are super tight and you know what I mean, and being sweaty or getting wet and then sit, like you're really like asking to please grow a fungus down there at that point with, you know, and so like you're just like, how do I make a fungus in my pants? Okay, I'm gonna get it nice and wet. I'm gonna have it be extra sweaty because there's no hair down there, and then I'm gonna, you know, wrap it nice and tight, keep it nice and warm.
And in a couple days, I can forage.
Like, yeah, exactly. You don't want to do that.
No.
I am a huge advocate for trimming. I feel like it's the best of both worlds. If you trim, you're still going to get a lot of the benefits of having hair and not necessarily open yourself up for infection and other issues. But you also are not necessarily going to get dingleberries when you're menstruating and other gross things that come with having long hair. So, and once again, if it's not a problem, it's not a problem. Something that I'm seeing some of my friends as we're kind of aging a little bit, your skin doesn't necessarily recover the same way when start getting older. Like I used to be able to shave bald at 16 and 17 and not have a single problem, and it was no big deal. My skin has gotten thinner and way more sensitive as I've gotten older. And so if I went and shaved bald, sounds terrible.
Terrible.
Yeah. So that's one of those things. If it's not a problem, it's not a problem. But if you start having problems, that's where I'd point the finger first, for sure.
That's fair.
I have a very vivid memory of when I first started dating my partner. I don't know how pubes came up. They just did. And he's like, I just need to let you know, never shave your taint. It's not worth it. He's like, I've tried it and it just hurts. It grows back terribly. He's like, I thought it would make me faster for track. It didn't.
For track.
So that's my husband's advice to all of you out there. Don't shave your taint.
Don't shave your taint. Yeah.
It's the same for the butthole. That I've thought about it recently, but then I recall just the
then you remember when it grows back.
Oh, it's like sand in your butt.
Oh, it's
but
so
closer
bad.
to your
itch that you're like,
you just
the worst.
moving in your seat all day because you just can't get that deep without going to the bathroom.
No,
so
I know. No, I feel like if you're gonna do the butthole, for sure wax it.
Yeah.
Like shaving's not even. It's not
a thing.
And it doesn't even make you faster. So
it doesn't even make you faster.
It doesn't even make you faster. So like, why are we doing that?
Yeah. No.
Ridiculous.
No, and if you want to build intimacy with your partner, having them trim your butthole is a great way to do that. You know,
I imagine it would be.
That is a suggestion, one of which I probably won't take up. But thank you for tossing that into the pile of things I'll think about.
The definition of intimacy, you know?
Trim my butthole.
Maybe I have intimacy issues then.
Hey, that's okay. Some people also believe that mystery is a good thing, and they may not be wrong.
They might not be wrong.
Who's really to say?
Who's to say?
Cass, I was just going to do our final wrap-up question unless you had anything else to ask.
That sounds good.
Okay. I feel like we could dive into just about anything over and over again with you. This is so much fun, and I feel like we're learning so much on just the basics. But for today, is there anything we didn't ask for this session that you feel like we should chat about right now?
I feel like every podcast I end up going on the same rant, but you know what? I'm like, the further this message can spread, the better. But don't fake orgasms ever. Like we've made a lot of commitments together in this podcast, right? We're all buying bidets now. We're not sleeping in thongs anymore,
Nope.
right?
We're wiping different. Yep.
We're wiping front to back. But also don't fake orgasms. And this plays into this because that goes back to learning how to advocate for yourself. I think if you can learn how to advocate for yourself with your extremely intimate partner, right? That's a great place to start, because if you can get comfortable advocating for yourself with your partner, that's going to further embolden and empower you to advocate for yourself with your healthcare providers. And also it's going to give you that practice so that if you do have children, these are conversations that you have had. You've said words like vulva and vagina and clitoris and labia, and you're comfortable with those words and you know where those parts and pieces are. And you've removed any of the shame around any of that type of stuff, right? We should be advocating for our own pleasure. We aren't always taught to because of the shame and possibly trauma, right? And we have to ask for more and we have to expect better. It's just time. And like, why live a life without orgasms, teaching your partner to do all the wrong things by faking it, when you could live a life with orgasms? Because like, at the end of the day, like, this body of ours, this is where we get to live for the rest of our lives. We should know every inch of it, and we should love it, because like, this is a vehicle that we're driving, right? We can get so caught up in like, it's not good enough because of this or this, but at the end of the day, this is it. So why not fall in love? Why not have all the orgasms? Why not advocate for yourself? Why not have a good doctor? Like, why not take good care of this vehicle that we have? Because this is the one. And like, YOLO, right?
I like YOLO, right? Poetic way to end, man.
It was either that or I was gonna get teary-eyed. So
So fucking
No, it
YOLO.
was beautiful. Fucking YOLO.
Where can our listeners continue connecting with you after this episode?
come find me on Instagram. So I that's definitely where I live. I just started like an email newsletter, so go subscribe to that. It's gonna be fun. And then yeah, the House of Vagina podcast will be coming back soon.
Amazing.
Long pause.
We're just gonna put it at that. I have 2 seasons up, so there's definitely some stuff to go dive into in the meantime, but she's coming back soon.
Amazing. Yeah. Did you love it or did you love it?
I was gonna open with genitals again, but we took it different ways, but that's totally fine.
Sorry.
I know, right? There's just not much you can't love about April. And we are so thankful that she was on the podcast this week to chat with us about vaginal health and vulva health, and giving us, my favorite line is still when we were talking about labia and she said, well, if I like remove them, because we're talking about labiaplasty, she's like, what would my husband munch on? And while foul, it was empowering.
Divinely foul.
Divinely foul. And isn't that what we all strive for in this world of sin? So thank you, April, for coming on the podcast. And thank you to our honeys for hanging out this week.
You can head on over to Apple Podcasts to rate, review, and subscribe to Honeydew Me. You can leave us a written review. A couple of you have left us written reviews recently, and they are so sweet. They just fill our heart with joy. One of them did mention that you miss how silly we used to be, and I appreciate that and love you so much. We'll aim to be sillier. Unrestrain ourselves.
Unrestrained.
We've tried to be adults, and clearly it isn't hitting with the masses. So
there's a demand for silliness.
There's
and I'm listening.
Such a demand. You can also rate us on Spotify. You can watch us on YouTube. You can head on over to TikTok or Instagram to follow along with our fun, I don't know.
Fun bits.
Our fun bits. Yeah.
Yeah, we're discoverable and we're waiting. So come find us and come hang out.
All right. Well, we'll see you next week for more genitals.
For more genitals. Oh, it smells like great chicken outside.
What a transition that was.
I thought you were leave you with
that. Yeah. Okay. Well, we love you. Bye.
Love you. Goodbye.